Kia ora, my name's Ayesha Verrall and I'm an infectious diseases specialist at the University of Otago, Wellington, and I'm just going to briefly update you on some developments in COVID-19 in New Zealand today. Firstly, we've had the launch of a government contact tracing app, which has two functions. It's firstly a way of updating your contact details with the government. And that sounds really simple, but you'd be surprised how often when people have been contact tracing in the last few months, they've not been able to reach the people they need to because we don't have the correct contact details. So it's really important we get that right, and by downloading the app and registering, you update the ministry's contact details for you. And that's the only data, when you do this, that leaves your phone. The rest of the data stays on the phone. The second function it has is a little bit counterintuitive, so I'm going to try and explain it to you. What it does is it has a QR code scanning function, and this works as a digital diary. So essentially, if you go to a venue and scan the QR code there, it will leave a record on your phone of where you've been. This is not really for contact tracing. The function of this is if you yourself are sick and a public health nurse is interviewing you about where you've been during the period you're infectious, you can check on your phone together with the nurse and see all the places you've been, and then the nurse can then contact that venue and ask for the venue register. So it is not at this stage a replacement for the venue register that those venues need to keep. It's really a digital diary. So those are the two developments on the app, and the ministry has announced it has plans to improve the app further. You can download it from the Apple Store, and also there's a version for Android, or look on the Ministry of Health website to see many of the questions about the app answered there. The other area I've been working on with some colleagues, particularly Nick Wilson, who's also from Otago, is about how best to structure testing in New Zealand to make sure that we're not having any undetected COVID circulating in our community. And obviously you would have heard the story that our testing's really ramped up in New Zealand prior to going into lockdown, which was absolutely fantastic effort made by communities and by microbiologists and lab workers. The problem we have now with very few cases of COVID-19 in New Zealand is finding the needle in the haystack. What if one case came through the border because of a slip-up in our quarantine there? We would want to be able to detect that early and to identify an outbreak early. And this is a matter of probabilities of identifying it. So what we've done is modelled that, and we found that if we're testing about 5,500, which is about where we're testing at the moment and certainly within our capacity, 5,500 people tested a day, then we'll have, it's most likely that we'll detect an outbreak when there's only 6 people infected. But the absolute limit, like the 95% limit of what we'll detect is an outbreak, maximum size 30. So I think that's really important to firstly help health services know how to plan their outbreak response, what sort of number of people they need to be ready for initially. And secondly, to just remind us that this testing of people with mild symptoms in the community is really an ongoing form of assurance that we need to make sure there hasn't been a reintroduction of COVID. And that requires all of us to maintain this awareness of COVID and that it could be the cause of a sniffle or a sore throat or headache or fever in the coming months, even though our level of concern about COVID might be going down because our case numbers are low. So we need to keep that could this be COVID in mind. And then finally, the other big thing that we've all been through together is going down the alert levels. We're now, after level 4, we went down to level 3 and level 2. And so now in our community, we have many people back at school, almost all workplaces are open, but there might still be social distancing, some people working from home when they can. And there's a limit still on gatherings, including gatherings and maximum sizes of gatherings in your home. So as time goes on, this gradual, for us, this gradual step down the alert levels has been about time And the longer we get from lockdown, the more time we have without discovering new chains of transmission, the more reassured we are that we've got control. So it must be a very low probability now that there's any cases that we don't know about. And the other reassuring thing is our number of active cases has reduced. It's down to 50. So we're because each active case poses a risk of transmission. So that's great to see that number come down, and it should come down further, all things going to plan. And as that happens, as those two things happen, we're able to loosen restrictions further, I hope. And I think I see a situation where we have confidence that we have achieved control or nearly achieved elimination from the public health point of view. However, what I see looking ahead is that we're also going to have to start, we can't rest on our laurels, because we also have to start having a conversation about how we safely manage the other aspirations the rest of the community have. So, for example, about reopening the border to trans-Tasman travel, or allowing international students to come back. All of those things will require a lot of public health input to make it safe, and the situation we really want to avoid is having lost all our hard-won gains. So I think that's the issue we'll all be talking about in the coming weeks from the public health side. So that's my wrap up for the day. My Twitter handle is Dr. Ayesha Verrall. Please reach out if you want to discuss any of these issues. Let me know if you've downloaded the app, and tell me how you've found it. Was it what you expected? I do encourage you to download the app and register it with your contact details. That would be a big help if we ever have a spike in cases. All right, thanks very much. See you later.